As an anesthesiologist, any case can lead to an emergency at any point of time. Within seconds or within milliseconds, things can go bad. As anesthesiologists, we face risks and dangers at any time of the day, at any moment of the day, and at any circumstance. So, this is exactly why it is important to process that information before, during, and after, because this is part of our profession to assess what went wrong and what went right and how we can make sure that such critical situations do not happen in the future. My topic for today is why do we need to do debriefing after every emergency encounter? Now, what is debriefing? You might ask me. Debriefing is basically a time period where the people who have been involved in a critical situation sit down, speak about it, speak about their experiences, speak about their emotions, speak about the protocol that has been followed, speak about what happened, speak about who could have done things better. And this is especially important because you will have to process a critical situation in order to perform better the next time. And critical situations always happen in anesthesia. It can be anticipated, it can be unanticipated, especially when it comes to a difficult airway or difficult intubation, or maybe during anaphylaxis, maybe when there's a desaturation, when the oxygen saturation is falling extremely fast, when it's dealing with a very obese patient or dealing with a very small child, or when a patient develops bleeding, excessive amount of bleeding during surgery, or even when it's something happens during the surgical side, in the surgical side, and then we have to take the corrective measures to make sure that the patient is safe. So we are humans, all anesthetists are humans. I mean, AI is becoming part of our culture right now, but for it to reach the extent of taking care of the patient from the beginning to the end completely by machine does not seem like it will happen very soon, which is why human factors are involved. Human factors in the sense that what happens to ourselves when we deal with the patient. The tempers are running high, our adrenaline is jumping through the roof, and we are stressed out. And even the best anesthetist may reach points where things may get out of hand. Which is why it is important to evaluate what are the conditions and what are the factors involved in making sure a critical situation is managed well. One is the human factors, as we all spoke about. Two is the equipment that we use. Are they working well? Are they audited every day or every week or every month to make sure that the repairs done at the right times and the batteries are recharged? All of the other instruments are working well, whether the expiry date is, whether they can still be used. Are the medicines effective? Is the machine effective? Are the processes in place? Because when you're dealing with a patient at 1 a.m. in the night, when you have been working continuously for about 18 hours, you will need to work at a spinal level and follow certain protocols. And to improvise and think in a moment when you are low on blood sugar and low on energy, this is when guidelines and protocols come into place which help you manage the situation better. So debriefing can happen immediately after a critical event. It can happen after 1 week, it can happen after 1 month. But what is important is to understand what went wrong and learn from your mistakes. And it is very important for a leader to sit down and do this because there are different levels of knowledge amongst the workers in the hospital. There's a different levels of competency and skills of the workforce. And there's a different level of maturity, of emotional maturity, of situational maturity, and even of the levels of knowledge regarding situations that are outside of medicine and outside of anesthesia. A good leader should have knowledge of psychology of people. He should have a knowledge of management techniques, how to deal with different people at different points of time. But what is non-negotiable is the debriefing that understands the emotions of the people during a critical incident, and working with them to deliver better care next time. So these are the reasons why debriefing is important when it comes to critical situations in medicine.